Percutaneous nephrolithotomy for the treatment of kidney stones, what you need to know. Let's talk about the anatomy of the urinary tract. Stones can form anywhere. The most common places are the kidney, the ureter, and the bladder. The typical indications for percutaneous nephrolithotomy, or PNL, also called PCNL, are large stones in the kidney, branch stones of the kidney, or large stones in the upper ureter that are not amenable to other therapies. There are some alternatives to PNL. Conservative management with medication, ESWAL, which is the use of shock waves from the outside to break the stones into small pieces, ureteroscopy, which involves looking up from the bladder with a telescope and using a laser to break up the stones, or open or laparoscopic stone surgery. Your physician will discuss all these options with you, and the decision for PNL is based on several variables: the location of the stone, how big the stone is, the density of the stone seen on imaging, the build and body habitus of the patient, and the type and severity of the symptoms of the patient. PNL is a very safe procedure. It's done through a small incision in the back. Risks include infection, bleeding, injury to the kidney, collapse of the lung, injury to surrounding organs, possible stricture or scar of the ureter, recurrent stones forming, the inability to remove all the stones, the need to place a stent or leave a tube in the back to drain the kidney, or the need for additional medical or surgical treatments. When a patient has a PNL, the patient's brought into the procedure room on a stretcher. Anesthesia will be administered and a small tube will be placed from below up into the kidney to allow injection of a contrast dye to visualize the kidney under X-ray. The patient will be turned face down on the operating room table. And under fluoroscopy, which is an X-ray, a needle would then be placed into the kidney. Through this needle, a wire is passed into the kidney and a balloon is used to dilate the tract through the skin into the kidney. A small tube is then placed over this balloon and a scope is inserted into the tract to look directly into the kidney. Under this direct vision, the stone is broken up with a special instrument that combines ultrasound with pneumatic pressure. The stone fragments are then completely removed. Once the stones are removed, it's not uncommon to place a small tube down into the ureter, into the bladder to allow fragments to pass. This is called a double J stent. Occasionally, a tube is also left into the kidney called a nephrostomy tube. Kidney stones are not typically smooth stones. They're usually jagged and may irritate the lining of the urinary tract. Sometimes a stent, a small tube in the ureter, may need to be used to help prevent swelling from blocking the ureter in the passage of urine. Any stones retrieved will be sent for analysis to aid in developing an effective program to prevent further stone formation. You may see blood in the urine following the procedure, and this blood may last several days to weeks. It's really important to drink a lot of fluids to help flush out the blood and facilitate the passage of any small debris of stone. You may have mild burning with urination that usually lasts a few days. Tylenol will help, and you may be given a narcotic pain medication prescription for severe pain. Most times you can return to work after several days following the surgery. You may have a ureteral stent in place for several days to weeks following your procedure, depending on your situation. You may need a procedure called cystoscopy to then remove the stent. After the procedure, you might be admitted to the hospital. Your hospital stay is 24 to 48 hours. You will have a catheter in the bladder the following day. The next morning, you'll get a CAT scan to see if there's any stone remaining. Many times you will also get a chest X-ray. You'll receive several doses of IV antibiotics as well as pain medication as needed. The dressing will be removed the following morning, and you can shower the next day. Most patients return to work and full activity within 2 weeks. After the procedure, patients usually go home by noon the following day if they are admitted. You'll be given prescriptions that might include antibiotics, pain medications, and medications for stent pain, such as Pyridium and Urabel. Patients will often use stool softeners if they're on oral narcotics to help with constipation. You will have careful instructions as to when you should follow up with a urologist. It is very important to call your doctor if you have a fever greater than 101.5, if you experience chills, severe pain unresponsive to pain medication, constipation, nausea or vomiting, or have excessive bleeding from the surgical site. The procedure itself can take 2 to 3 hours on average, but every case is different. Much of this time is actually due to positioning once the patient is asleep. Plan to arrive at least 90 minutes before your surgery, and you will need to have somebody drive you home. Our surgical coordinator will contact you about arranging a time for your surgery. It's very important to come in for a urine culture 7 days before your surgery. You will be contacted with a surgical date and instructions of where and when to report for surgery. Usually you will need to see your primary care physician to get a physical examination, have blood work, and maybe an EKG done to clear you for surgery. Nothing to eat or drink after midnight the night before surgery unless otherwise instructed. You may need to stop aspirin or blood thinners depending on your physician's instructions. Please never stop aspirin or blood thinners without first talking to your primary care doctor. Bring a list of medicines with you to your surgery, and please arrive 90 minutes before your scheduled surgery. Preauthorization of the procedure is important. We will communicate with your insurance company to determine your coverage and any co-payments or deductibles that you might owe. We'll provide you with an estimate of charges that you may incur, and all charges are due prior to the procedure. Payment plans can be arranged. Stone analysis may be performed if a specimen is obtained to determine the type of stone to help with further prevention or stone treatment. You may have your urine sent for culture. If the urine is cloudy, this may help your physician treat the infection with the correct antibiotics. These tests will usually be covered by insurance, but may not be included in your estimate. It's important to know that if you were a stone former, you are at risk for making more stones. You should discuss with your urologist additional workup and therapy to prevent further stone formation. All stone formers are highly encouraged to drink large amounts of fluids. We hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure, as we're always trying to improve the care that we provide our patients. If you have any questions regarding your procedure, please contact your doctor. Thank you.